afternoon. Welcome to the press briefing today. On the stage, we have Dr. Zhang Shukwen, Head Communicable Disease Branch of the Center for Health Protection, as well as Dr. Lau Ka-hin, Chief Manager, Hospital Authority. Dr. Chen will start with an update. Good afternoon. In the past few days, we have repeatedly explained the following. Some positive red test cases have later found to be negative upon a PCR test, and then the threshold of false negative has exceeded our acceptable levels. We have made an announcement, and then we have found that a certain proportion of the people who submitted their records are found to be false negatives. We have to delete the false negative cases. This is not satisfactory. Therefore, we decide that starting from today, we would like to make a change to the way that the cases are reported. That is, for RAT test cases, before they are confirmed by PCR tests, they will not be regarded as a confirmed case. Therefore, we'll only announce the number of cases of positive red cases confirmed by PCR tests. Yesterday, for those confirmed by PCR tests, the number was 231 cases, 51 submitted by the HA, 23 by the laboratory of the CHP, and then for the others, they were submitted by private laboratories. That is 157 of them were reported to be positive. And then for the past few days, there were successful registration of positive red cases, and they were also confirmed by PCR tests yesterday. There were 258 of them. Among them, we had included red tests that were positive. But then we have also got a PCR sample, and then the reports were out yesterday. Therefore, the total for positive cases is 487. The total in the fifth wave, we have 1.23 million 3,003 cases. In fact, some have been reported twice, and therefore we have included cases that were not counted in the past. Among all the cases, 53 of them are imported cases. 32 were found upon arrival in Hong Kong at the airport. 21 arrived on the 6th of June. 11 cases arrived on the 5th of June. For those arriving on the 6th of June, they came by 9 flights, and then for those on the 6th, they came via 6 flights. And then there were cases found at quarantine hotels, and there were 3 cases found after the 7th day. There were 3 cases found on the 10th day as well as the 11th day. There were 3 cases with very high CT values, ranging from 33 to 37. There was this case that was already a positive case overseas on the 3rd of May. Arriving from the other cases arrived from Singapore and the UK without any medical record, but we still suspected that it was a case of repositive. We'll carry out a genomic analysis to confirm whether it is a local case or imported case. And then for the homes for the aged or the disabled, today we have a staff member that was tested positive. There were 10 close contacts found at the RCHE. They will all be sent to a quarantine center. For this staff member, I believe that the staff member was infected in the community. The last infection in this home was on the 29th of April. For schools, the caseload has dropped. 72 cases were reported by 62 schools, with 56 staff members and 56 students and 16 staff members. 56 students came from 11 kindergartens and 20 from as well as primary schools, 20 from secondary schools, 1 from special schools. So the 16 staff members, 1 from kindergartens, 8 from primary schools, and 7 from secondary schools. 30 of them tested positive today. 42 were tested positive either yesterday afternoon or earlier. And then for Kowloon Tong, Funfo English Primary School, we have an additional case, but in fact, the case was a sibling of an earlier case, a total of 13 so far. And then for the basketball class, we verified with the school. In fact, they have got 2 cases, one on the 1st of June with 9 cases, and then the other on the 8th. And there was a case attending both classes, 13 students and 1 teacher in total, out of which only 3 cases. For the remaining 10 students and the other teacher, they have to be home quarantined. And then we have the international session of Sujiang School. We have got a class called P5R. 31 students in total. Some students fell ill one after another. We asked the class P5R to suspend classes for a week. For death cases, 3 more have been reported. They have all been reported by the hospital authority, bringing the total to 9,098. Reported by the HA, the overall total of death cases, 9,176. For the suspected local cases of Omicron, there are 4, BA.2.12.1. 2 of them resided in Chik Fuk building. Well, earlier on, there was a case in the family, and that simulation to a young child attending a Christian school. And then the family member was also suspected to have suffered from BA.2.12.1. And in fact, 2 of them were found to be having a meal together with someone living at Yisan Mansion in Tai Kwu Shing. And that's on Koshan Terrace. The meal took place on the 28th of May. And then another case hasn't got its source identified. 11 years old, Yansing Court Yan Yun building, a 15-year-old girl, and she together with a 67-year-old family member are both infected. The family member was infected earlier than this girl. And then for the bar clusters, for Link, we haven't got any new cases. The total remains at the same level. For Shuffle, today we have got 12 more cases, bringing the total to the following number. There is 91 customers and 6 staff members, 61 are females. Aging between 18 and 48. That's all from me today. Dr. Lau, please report to us about the case in the HA. 372 confirmed patients are inpatients. 55 of them are newly admitted. For those that have to be isolated, 92 of them are in isolation wards, 9 in second-tier isolation wards, 33 are staying at the North Nantou Hospital Hong Kong Infection Control Center. 24 are newly admitted patients. Yesterday, 1 patient was reported as in critical condition, and then 1 in a serious condition. Among the confirmed patients that are inpatients, 12 of them are critical and 7 are in serious conditions. Out of them, 6 are staying in an ICU. And then we have got 3 patients who passed away yesterday, a male and 2 female patients, aging between 81 and 93 years old. The 3 of them had one of them coming from a home. Two of them had not got a vaccination record. One had 3 jabs. For the 3 patients who passed away yesterday, for the youngest one, he was 81 years old, a man with 3 jabs, with high blood pressure, high lipid levels, as well as diabetes. And he had a terminal stage of lung cancer spreading to different parts of the body, including the brain. He was admitted to hospital with nothing to do with COVID-19. He mainly came to the hospital for cancer treatment. And he passed away while staying at the hospital.
Another person was a 90-year-old female. She lived in a residential care home for the elderly, and she had chronic diseases, including chronic kidney failure and heart problems, and also issues with the lung. Midnight on June 6th, she was found unconscious. An ambulance was called. And the ambulance team members found that her heart had stopped beating, had no breath, and when she arrived at the hospital, she could not be saved. The last case was a 93-year-old male. She also had chronic diseases, diabetes, high blood pressure, and kidney failure, heart failure, and also anemia. She was admitted to hospital yesterday in very poor physical condition. Well, he was admitted on June 5th, and then could not be saved either. In the past 24 hours, 47 patients have been recovered, 42 have been discharged. Under the 5th wave so far, we've got 50,585 patients who've recovered, of which 50,195 patients have been discharged since early 2020. Hong Kong, 62,965 patients who recovered. Among them, 60,575 patients have been discharged. One patient was found to have been confirmed during screening in hospital, and one patient in the same ward was thus found as close contact. Among hospital staff, 23,598 staff have been infected. Of them, 23,441 have returned back to their duties. I want to also share with you an announcement. We noticed that online there were discussions about confirmed children and the policy regarding them in public hospitals. So our policy right now is all along HA promotes care for children and support for families. And this concept is applicable to children confirmed with the virus. Once the children are confirmed with the virus, if they need to be treated at hospital, they will be put in isolation facilities for children at hospitals, and the medical staff concerned will provide relevant treatment for them and care for them as well. If parents of the children or if the caregivers for them are also confirmed, and if they are able to continue to care for the patients, then the hospitals will try as much as they can to have the caregiver parent to be in the same ward with the children. If the parent or caregiver is not confirmed and yet they want to accompany and care for the children, then the hospital will try the best to arrange for them to move to the isolation facility. And medical staff will explain carefully and clearly to the caregivers the risk of infection and teach them how to follow the anti-infection guidelines and rules. And while in hospital, the medical team would have close communication with the parents and caregivers, and if needed, they would report to them the latest treatment and try to provide video or telephone communication with the parents or family members. So now is the time for Q&A. So please tell us before you ask a question which media outlet you're from. This lady first. Hong Kong 01. I want to ask about the latest method for testing. How many cases have been deleted so far, which tested positive in RAT but were negative in PCR test? You announced in the previous days that there were about 270 RAT cases. So is it that all of them have been actually the latest result of your PCR test? And now you just told us a new way of announcing the cases. But when did your center start the process of screening all RAT tests? Since which day? In May or June? And also, is the center of the view that, what are the reasons for the high number of false positive cases? Besides the reason or the intention to get vaccine exemption, so if the test results are false, then would these people still receive the relevant SMS messages? So Dr. Chuang, can you respond? In the past few days, the false positive cases, that is those tested negative in PCR test, while the RAT results are positive, the ratio of them is 15 to 25%. So we will delete all these false positive cases. At the end of April, we had started, actually for most RAT tests, we would do a PCR test on them. If the results are negative, then we would delete those cases. We want to carry out isolation quickly and impose quarantine quickly enough. Therefore, on the RAT platform now, for those cases reported on the platform, we still issue the isolation and quarantine order for the family members. But once we know that it is a negative case or there's no positive result, then the case itself will be cancelled. And the information will be deleted from our central center. And so the person concerned would not be able to use the isolation order as actual proof of recovery. This lady over there at the back. Orange News. I want to ask about the Changshu and Zhejiang Primary School. 7 students and teachers were infected. How did the transmission occur? Do you know what is the channel? And also, did the infected students stay close to one another? Did they remove their masks in the classroom? In Kowloon Tong, there was also a case of B.2.12.1 case. Did you find the source of the case? And of the 2 untraceable cases found today, do you think that there's a chance that the virus has been spreading widely in the community? And also, I'd like to know, what does the CHP think of the current status of the pandemic? And now, if for all RAT cases, they have to be reviewed by PCR tests again. So what do you expect the fluctuations will be in the number of cases from now on with the follow-up tests? The Changshu Zhejiang Primary School cases, the students concerned, they actually sat quite close to one another. Some sat right next to each other. So actually 5 out of total of 31 that seems to be some contact transmission. They must have been infected within the school, we think. During the recess, they must have removed their masks to drink or have snacks. There are some petitions. We know that Omicron is so contagious. And in the classroom, even though most students will be wearing masks, there's still a chance for transmission. And that's why we think that each student and teacher should do RAT on a daily basis so as to reduce the transmission within the school. For this particular school, the transmission had definitely occurred. So we suggest that it suspend its classes and go for large-scale cleansing. And the case concerned, B.A.2.12.1 case, we don't know the source yet. In the community right now, there could be some invisible transmission chains, but not to the extent of widespread transmission. The pandemic right now continues to fluctuate, as the chief executive says. We don't know what's going to happen yet, or what is the latest situation yet.
The next one, yes, in the last row. Good afternoon. In recent days, over 40 buildings have been named for restriction and testing. If people haven't come forward to get tested, what will happen to them? And what is the role of the CHP? Would it be the end of your duty after you have issued the declaration or the notice, and will be left to other departments? Well, for compulsory testing notices, CTN, we count on the cooperation of citizens. But if it is found that individual citizens have breached the CTN, then of course they will be sort of having legal action taken against them. The gentleman on the side. I'm from AM 730 for the red test. It is said that the test results will be verified. What about previous records? Will they be deleted? And then for the total caseload, it is said that the test results have to be confirmed before you will include them in your daily caseload. Are you going to revise the figures for the previous few days? So are we going back to the earlier days when you used to tell us about the number of preliminary positive cases? And in this way, it means that we are 1 or 2 days behind the actual situation. Would it be meaningful? And then for the girl who had the subvariant, does it mean that the 2 households were involved in the subvariant? And then for the Jiangsu Zhejiang Primary School, can you give us the address? And then for the red test, does it mean that you will regard them as positive cases first and handle them likewise before they get confirmed? For the Jiangsu Zhejiang Primary School International Section, I haven't got the address with me. Please search for the address online. In relation to the sending of emails, of course, if it is a special case, if they send an email to us, we will handle them in an exceptional way. For the adjustments, we may not be able to come up with the latest figures very swiftly. Well, probably it is a matter of you are interested in the trend, but we are not able to make an immediate announcement whenever we make changes or adjustments to the caseload. For the student, attending Poland-Cook Camming School, there is a suspected case of BA.2.12.1. Sorry, the speaker is off mic. It's the international section of the Jiangsu Zhejiang Primary School. Sorry, the speaker is off mic. We cannot hear the question. Well, it's not a matter of lagging behind for a long time. Well, for the number of PCR positive cases, we don't actually get them yesterday. Usually, the report came after a couple of days. And then if the red test is confirmed or not by a PCR, it won't lag behind for too long. Ming Bao. For the BA.2.12.1 cases, that is the one from Jikfuk building in Wan Chai. When was the onset of disease? When did the patient had meal with the one from Eon mentioned? Is it a matter of Eon spreading to Jikfuk or the other way around? And what about the student attending Sidoi school? And then just now, you mentioned that you got 258 RAT cases covering a few days back. How many of them were reported yesterday and covering how many days? And then you talked about having it confirmed by contractors. But this morning, Mrs. Carrie Lam said that it would be the government laboratories that would be confirming the test results. And is there any difference in terms of the process between the test being done by a contractor or it being done by the government laboratory? And starting from which day in April did you start confirming the RAT results with a PCR test? For the BA.2.1, 2.1, I think is the Yishan mentioned case spreading the virus to the one living at Chetfoyd Mansion on the 28th of May. There was a CTN covering a Chinese restaurant. For contractors, it was in the latter part of April. In the past, we used to have random confirmation towards the end of April for the number of RAT positive cases. The level was such that we were able to cover all of them, and so we did so. But earlier on, the caseload was too high. We're not able to cover all of them, so we could only have a random test. All the time, we've been relying on the contractor to carry out the sample taking, but then the the analysis was done at our laboratory. They were responsible for collecting the specimen. Sorry, the speaker is off mic. Sorry, the speaker is off mic. For the student, sore throat on the 2nd of June, RAT on the 3rd of June. For the family members, on 2nd of June, RAT test positive, no symptoms. For Jet4 mentioned, coughing started on the 2nd of June. For the other one, some headache started to emerge on the 4th of June. RAT also on the 4th of June. Both of them had the RAT tests on the 4th of June. The reporter on this side, Hong Kong Economic Times, would you call the RAT cases as preliminary positive, like what you did in the past? For today, how many RAT positive cases have you got? Yet to be confirmed. Now, I want to know whether the PCR confirmation will be carried out the same day, and what is the capacity? Can you only deal with a few hundred only? Beyond which level would you then have to wait for the following day to get the PCR confirmation? And then when you declare to the RAT platform, then you have a QR code, right? And when the PCR test is negative, can the QR code still be valid? Now, two people, I want to know whether 3 or 4 students went to the basketball class. Three cases upon clarification with the school. For the number of students, there were 4 of them attending both classes. There were 2 classes, one on the 1st of June, the other on the 3rd of June. Well, in the case of an RAT positive case, probably it will be tomorrow that will be sending out a sample bottle to be collected, and then the result will be out the day following tomorrow or even 2 days after tomorrow, depending on when the specimen bottle was delivered and collected. Well, on the same day, the person making the declaration will receive the isolation code order. As to whether the QR code will still be valid, well, in fact, we will be deleting the record. The next reporter, the lady in the back row. Good afternoon. I'm from Cable TV News. What about the case without an identifiable source living in Fanling? Do you have a rough idea as to where the infection took place? And then for schools, it is said that they would be the last group of premises to have the social distancing rules relaxed. Do you have any guidelines for schools? For the suspected case of BA.2.1, 2.1, we are not able to identify the source. Understand that there is a core group at the high level of the administration. They will also consider and judge all sorts of social distancing rules. Let's take the last question from the gentleman at the back. I'm from Now TV. Well, today we have told us about the number of RAT tests. 258 RAT cases. How many of them were reported yesterday and how many on other days?
I don't have the figures, but as I said just now, there are mostly cases, RIT cases from the 4th. Some might have been given to us earlier, some later. Okay, that's the end of today's briefing. Thank you.